Preventing blood clots is a crucial aspect of maintaining cardiovascular health and reducing the risk of serious complications like strokes or heart attacks. While medical treatment and doctors' advice are essential in managing blood clot risks, some foods have been shown through scientific studies to support healthy blood flow and act as natural blood thinners. These foods may help dissolve existing clots, or, more accurately, reduce the likelihood of clots forming in the first place, thanks to their bioactive compounds and effects on the circulatory system. Let's discover 9 foods that may help dissolve blood clots and prevent strokes, exploring the science behind them and how to include them in your diet for better heart health. First, let's talk about garlic. Throughout history, garlic has been renowned not only for its strong flavor, but also for its impressive health benefits. Garlic contains sulfur compounds, notably allicin, which give it a unique aroma and a potent physiological impact. Scientific studies have demonstrated that garlic can modestly reduce blood pressure, lower LDL cholesterol, and, crucially, help reduce blood clot formation. Garlic's antiplatelet effect means it can make blood platelets less sticky, thereby helping to prevent the formation of dangerous clots in the arteries. To maximize these benefits, use fresh crushed garlic in your meals, as allicin is produced only when garlic is cut or chopped. Whether added to soups, salads, stir-fries, or used as a seasoning, garlic is a flavorful and effective addition to a clot-preventing diet. The second food is ginger, a root known for its sharp flavor and anti-inflammatory effects. Similar to garlic, ginger contains active substances, gingerols and shogaols, which have shown to slow down the clotting process by inhibiting the activation of platelets. Eating ginger regularly can support vascular health, reduce inflammation, and lower the risk of clot formations. Fresh ginger can be grated into teas, smoothies, or sprinkled over stir-fries, and dried ground ginger is a great addition to both sweet and savory dishes. Next, let's talk about oily cold water fish, such as salmon, mackerel, sardines, and trout. These fish are rich in omega-3 fatty acids, particularly EPA and DHA. Extensive research has revealed that omega-3s reduce inflammation, lower blood triglyceride levels, and importantly, inhibit platelet aggregation, which is a major step in clot formation. People who consume oily fish at least twice a week tend to have a lower risk of stroke and cardiovascular disease. Grilling, baking, or poaching these fish preserves their beneficial oils, and even canned salmon and sardines retain their omega-3 content. For those who dislike fish, a doctor may recommend high-quality fish oil supplements, though food sources are always preferable. Another powerful blood-thinning food is turmeric, the golden yellow spice that forms the basis of many South Asian dishes. Curcumin, the active compound in turmeric, has been widely studied for its antioxidant, anti-inflammatory, and anticoagulant effects. Curcumin appears to suppress several pathways involved in blood clotting, making blood less prone to forming unwanted clots. Turmeric can be stirred into curries, blended in smoothies, or taken as a tea. Combining turmeric with black pepper increases the absorption of curcumin, making it even more effective. Berries, especially blueberries, strawberries, and cranberries, offer another route to cardiovascular protection. Rich in flavonoids and antioxidants, these fruits promote vascular health by improving endothelial function and reducing platelet aggregation. They can also help lower blood pressure and manage cholesterol, which further reduces the risk of clot formation. Regularly including a handful of fresh or frozen berries in yogurt, oatmeal, salads, or enjoyed as a snack can be a delicious way to support healthy blood flow. Natto is a lesser-known but exceptionally potent food for preventing blood clots. This traditional Japanese dish, made from fermented soybeans, contains an enzyme called natto kinase. Research suggests that natto kinase can break down fibrin, a key protein involved in blood clot structure, and thus help dissolve existing clots or prevent excessive clotting. While the taste and texture of natto can be polarizing, for those who enjoy it, including natto in the diet a few times a week can be highly beneficial for vascular health. Natto kinase supplements are also available, but their use should be discussed with a healthcare provider, especially for those already on blood-thinning medication. Citrus fruits, such as oranges, lemons, limes, or grapefruits, are high in vitamin C, antioxidants, and a flavonoid called hesperidin. These compounds help lower blood pressure, strengthen capillaries, and reduce inflammation, all of which contribute to healthier blood and lower clot risk. Citrus fruits also contain natural blood-thinning agents that can impede platelet aggregation. A glass of freshly squeezed orange juice, lemon water, or simply incorporating fruit slices into salads and meals can provide these benefits. However, grapefruit can interact with certain medications, so always check with your healthcare provider. One food beloved by many for its versatility and health effects is tomato. Tomatoes are abundant in lycopene, a powerful antioxidant, as well as vitamin C and potassium. Lycopene has been linked to improved vascular function and a reduced risk of heart disease. Eating tomatoes also appears to lower the clotting tendency of blood by reducing platelet aggregation and supporting healthy blood vessels. Fresh tomatoes are great in salads or sandwiches. Tomato paste can add richness to sauces and stews, and even cooked or canned tomatoes retain high levels of lycopene. Lastly, dark leafy greens like spinach, kale, and Swiss chard are rich in magnesium, nitrates, fiber, and a cocktail of vitamins and antioxidants. These greens help relax blood vessels, support healthy blood circulation, and lower blood pressure. However, if you are taking blood-thinning medications like warfarin, you need to monitor your vitamin K intake closely, as too much can interfere with the medication's effectiveness. For most people, however, leafy greens are an excellent source of nutrients that promote overall vascular health and keep blood flow smooth. To gain the most benefit from these foods, consider a few key principles. Variety is important. Combine several different thrombosis-preventing foods in your weekly diet rather than relying solely on one item. For example, you might begin the day with a smoothie of berries and spinach, add ginger or turmeric to a warming lunch soup, and serve grilled salmon with a zesty tomato and citrus salad for dinner. Add garlic to your vegetable stir-fries, try natto if you're adventurous, and snack on fresh fruits for maximum effect. Bear in mind, however, that foods and natural supplements are not a replacement for prescribed blood thinners or medical intervention for those at high risk of clotting disorders or stroke. Always discuss with your doctor before making dramatic changes to your diet, especially if you're already using medications to thin your blood, as combining these foods with pharmaceuticals can enhance the effect and provoke undesired bleeding risks. Let's take a deeper look into why blood clots are a concern and how these foods work at a biological level to support healthy blood flow. Blood clotting is a natural and essential process to prevent excessive bleeding when you are injured. Platelets, a component of blood, activate and stick together to form clumps, which then mesh with fibrin, forming a solid plug that closes wounds. However, sometimes these clots form inappropriately inside blood vessels, especially if the vessels are damaged by inflammation, buildup of cholesterol plaques, or poor blood flow. When a clot forms in an artery that feeds the brain or heart, it can cut off blood supply, leading to either a stroke or a heart attack. Risk factors for dangerous clotting include high blood pressure, obesity, diabetes, smoking, sedentary lifestyle, genetic predisposition, and some chronic diseases. That's why a proactive approach using diet and lifestyle changes can be a powerful tool to maintain long-term cardiovascular health. Foods with blood-thinning properties generally will work by one of several mechanisms. They inhibit platelet aggregation, reduce inflammation, help maintain good cholesterol levels, lower blood pressure, or directly interfere with the clotting cascade that hardens fibrin. Garlic, ginger, and turmeric reduce platelet stickiness. Omega-3 rich fish inhibits clotting factors. Nattokinase dissolves fibrin itself. Berries and citrus fruits fight inflammation and oxidative damage that lead to vessel injury and clot formation. Leafy greens, by improving vascular elasticity and reducing blood pressure, also help protect against stroke risk. Another aspect to consider is that eating for vascular health usually aligns with eating for overall wellness. A diet rich in whole plant-based foods, healthy fats, lean proteins, and abundant colorful vegetables and fruits supports not just blood flow, but also immune function, cognitive health, and reduces the risk of several age-related diseases. These dietary patterns provide vitamins, minerals, antioxidants, and fiber that your body needs to repair, protect, and function optimally. Hydration is also an important, sometimes overlooked factor in clot risk. Dehydration can thicken the blood and make clots more likely. Drinking enough water, as well as including high water content foods such as fruits and vegetables, can help keep your blood viscosity at a healthy level. Physical activity complements a healthy diet in preventing blood clots and strokes. Regular movement, whether brisk walking, cycling, swimming, dancing, or gardening, boosts circulation and keeps blood from pooling in the legs, further lowering the risk. If you have a sedentary job, make sure to stand and stretch every hour and to take short walks across the day. Stress management techniques such as mindfulness, yoga, or simply making time for relaxation and adequate sleep also play a role in vascular health. Chronic stress can increase inflammatory markers and blood pressure, both of which contribute to clot risk. Combine your dietary changes with lifestyle habits for a truly comprehensive approach to prevention. Certain foods and drugs can increase your clotting risk and should be consumed with caution. Highly processed foods rich in trans fat, saturated fat, and sugar, along with high salt intake, contribute to inflammation, hypertension, and arterial damage. Limiting red and processed meat, eating less fast food, and focusing on homemade balanced meals with plenty of plant ingredients is ideal. Heavy alcohol use can also increase clot risk, despite the reputation that red wine, due to its polyphenols, may be helpful in moderation. If you drink alcohol, do so sensibly and within recommended limits, as excess drinking damages the liver and raises blood pressure. Smoking is a major and preventable risk for clotting, as it damages vessel walls and promotes the stickiness of platelets. Quitting smoking, as hard as it may be, massively lowers the chances of stroke and heart attack, regardless of age. Some herbal supplements also possess anticoagulant properties and can interact with both foods and medications. For those considering supplements like ginkgo biloba, willow bark, or high-dose ginger, it's crucial to consult a healthcare provider about safety and possible drug interactions. Lastly, knowing your personal risk factors can help you tailor your diet and lifestyle for the best protection. If you have a personal or family history of clotting disorders, hypertension, diabetes, or if you are taking hormone-based medications such as birth control or hormone replacement therapy, you may need extra vigilance in regular checkups with your physician. Blood tests and physical exams can help monitor your risk and the effectiveness of any interventions you pursue. In summary, preventing blood clots and strokes involves far more than just eating the right foods. But making smart dietary choices provides a real and lasting foundation for long-term heart and brain health. By favoring foods such as garlic, ginger, oily fish, turmeric, berries, natto, citrus, tomatoes, and leafy greens, you supply your body with a broad spectrum of nutrients and bioactive compounds that are proven to protect blood vessels and promote smooth, healthy blood flow. Be mindful of balance, variety, and moderation, and complement your diet with active, stress-reduced living. Discuss any significant dietary changes with your healthcare provider, especially if you are already on blood thinners, to ensure your approach is safe and individually appropriate. Start now by examining your meals and looking for opportunities to incorporate these powerful foods. Enjoy experimenting with new recipes and flavors, and notice how even small changes can add up to meaningful benefits over time. Keeping your blood flowing freely is not just about preventing illness, it's about maintaining energy, focus, vitality, and the ability to enjoy life to the fullest every single day.